Today on Cancer Buzz, a better patient experience in the management of incidental lung nodules. I'm your host, Summer Johnson. Our guest today joins us to discuss a well-coordinated lung nodule care experience, supporting patients, families, and primary care providers. Dr. Nikhilesh Korgaonkar is a thoracic surgeon and the chief medical officer at the WellSpan Cancer Institute. When did your team realize that you needed to improve the way you managed incidental lung nodules?
Yeah, it was really, it was a project that was born out of a patient experience. And we realized that while this patient had sort of unique access to leadership at WellSpan to affect change, that this was a problem that was, far greater and really much more universal than this single patient's experience. We also understood that lung cancer screening is something that's underutilized, that more patients can benefit from it than currently undertake or undergo screening. And we thought it was important to have a process that could accommodate those patients and could do the right thing for them. And it was, with that as background and with a desire to create a program that really addressed all issues of the Quadruple Aim that we brought the group together to make this program.
How does that lung nodule workflow work?
It operates through all of our geographies and in all of our entities. So it will take incidental findings from any type of study, whether it's chest CT or an abdominal scan, and address incidental lung findings. So it takes sort of a wide group of patients and channels them into the right workflow to address the findings that we have. It is largely algorithm driven, and those algorithms are vetted annually by an expert team. And it is also very much driven by two fantastic nurse practitioners who have a lot of passion for this work. And between the algorithms that kind of make up the backbone and the nurse practitioners who add the brain and the heart to it, it makes it easy for us to do the right thing for these patients.
How about patient outcomes? What's been the impact on those?
Yeah, it has resulted in, streamlined access to specialists and to patients. It has specifically resulted in a decrease in the number of days from finding to definitive input or definitive treatment. And, we know that catching lung cancers early results in lives saved. So while I can't necessarily quantify the number of lives saved from this, we know that it's there.
What do you think is some key information to look for there?
I think, the article has a lot of great information in there, and I think it can really serve as a blueprint for other systems that want to emulate this. One thing I will say, however, is that I cannot understate the importance of making sure all the stakeholders are on board with a program like this. We have stakeholders in radiology, in primary care, in pulmonology, and of course, in administration. And this program is the result of making sure that everyone was on the same page with the goals and the desired outcomes of this program. And that really has set this program up for success.
Thank you, Dr. Korgaonkar. You can check out the show notes for a link to Dr. Korgaonkar's article, out now in the latest Oncology Issues Journal. That's online now or in your email inbox. Until next time, this is Summer Johnson.
This show is a resource of the Association of Community Cancer Centers.